Managing Carcinoid Syndrome, Diet, Drugs, and Lifestyle Strategies. Hello, this evidence-based content is prepared by Saboor Khan, fellowship-trained consultant surgeon, and if you or someone you care about is living with carcinoid syndrome and wondering how to manage the daily challenges beyond your medication schedule, you're in the right place. Carcinoid syndrome is the most frequent hormonal complication of neuroendocrine tumors. These are tumors that produce excessive serotonin and other bioactive substances. According to research, carcinoid syndrome occurs in about 20 to 30% of patients with small intestinal neuroendocrine tumors who have liver metastases. The classic symptoms are chronic diarrhea, skin flushing that typically affects your face, neck, and upper chest, sometimes bronchospasm with wheezing, and abdominal discomfort. This happens because when tumors spread to the liver, these hormone-releasing substances bypass normal liver breakdown and enter your circulation directly. Managing carcinoid syndrome isn't just about taking your medications. It's about understanding your body's triggers, maintaining your nutrition, recognizing warning signs, and building a comprehensive daily strategy that preserves your quality of life. Nutrition counseling is recommended to improve nutrition status, control diarrhea, and avoid foods that trigger carcinoid symptoms. Certain foods can directly provoke flushing and diarrhea because they either contain high levels of tyramine or stimulate serotonin release. The diarrhea in carcinoid syndrome is always secretory. It persists even with fasting, may occur during the night, and is associated with abdominal discomfort and fecal urgency. This is fundamentally different from other types of diarrhea, and managing it requires addressing both the hormonal cause with medications and the nutritional consequences. In the presence of carcinoid syndrome, your body converts the essential amino acid tryptophan to serotonin, leaving inadequate amounts for conversion to niacin and proteins. Patients with niacin deficiency may develop pellagra, with dermatitis, diarrhea, and dementia. Niacin or nicotinamide supplementation at 200 to 250 milligrams once daily is recommended. Diarrhea in patients with carcinoid syndrome can cause dehydration, electrolyte abnormalities, and low protein levels. Prioritize consistent hydration throughout the day. We're not talking about just drinking when you're thirsty. By then, you're already behind. For patients with severe diarrhea, weight loss, vitamin deficiencies, and low protein levels, parenteral nutrition and adequate supplementation may be needed before major surgery. Deficiencies of fat-soluble vitamins should be looked for and adequately substituted. Nearly 1/4 of patients receiving somatostatin analog medications develop pancreatic insufficiency with fat malabsorption, with more than 90% occurring after 6 to 24 months of treatment. This can be treated with oral pancreatic enzyme supplements. For breakthrough diarrhea, despite SSA therapy, anti-diarrheal agents such as loperamide may be useful, particularly in patients with short bowel syndrome. You can use this as needed when symptoms flare. If you're having breakthrough symptoms between your long-acting injections, short-acting octreotide 100 to 500 mcg subcutaneously every 6 to 8 hours can be used. This is something to discuss with your doctor for keeping on hand. If your symptoms aren't controlled on standard label doses, dose escalation can offer symptom improvement in nearly 80% of cases. This might mean shortening the injection interval from every 4 weeks to every 2 to 3 weeks, or increasing the dose. When SSA doses are escalated, you need monitoring for specific side effects. Patients with impaired glucose tolerance or diabetes should be monitored closely when SSA therapy is initiated or adjusted. Vitamin B12 deficiency may occur with SSA therapy and should be supplemented if detected. Flushing is reported in over 90% of carcinoid syndrome cases. It is usually an intermittent or persistent sensation of warmth together with skin redness, typically involving the head, neck, and upper part of the torso. In carcinoid syndrome, flushing is usually not associated with sweating. Flushing results from circulating vasoactive substances inducing cardiovascular changes, including blood pressure fluctuations and heart rate changes. Specific triggers include alcohol consumption, certain foods high in tyramine, emotional stress, and physical exertion. When flushing occurs, sit or lie down if you feel lightheaded. The associated blood pressure changes can cause dizziness. If you've identified a trigger, avoid it going forward. If flushing episodes are becoming more frequent or lasting longer, this warrants a conversation with your specialist. Refractory carcinoid syndrome is defined by recurring or persisting symptoms and increasing or persistently high urinary 5-HIAA levels, despite maximum label doses of SSA, are drugs used to treat carcinoid syndrome. Aggressive means 4 or more bowel movements per day, and/or 5 or more flushing episodes per day. If you're having more than 4 bowel movements daily, or more than 5 flushing episodes daily on your current dose, contact your specialist within days, not weeks. Document your symptoms, how many episodes, what triggered them, how long they lasted. Carcinoid crisis is a potentially life-threatening complication caused by the sudden release of high levels of serotonin and other vasoactive substances. It is defined by abrupt flushing, severe shifts in blood pressure with cardiovascular instability, profuse diarrhea, and distressing bronchospasm with wheezing. For prevention, if you're undergoing any procedure or surgery, octreotide subcutaneous injections, 100 to 500 mcg every 6 to 8 hours before and during the procedure, are recommended. Make sure any healthcare provider performing procedures on you knows about your carcinoid syndrome diagnosis. Treatment involves immediate intravenous octreotide, both bolus doses and continuous infusion, along with intravenous fluids, corticosteroids, and sometimes vasopressors. If you are experiencing severe flushing with blood pressure instability, severe facial swelling, shock-like symptoms, or severe breathing difficulty, call emergency services immediately. Start keeping a food diary for 2 weeks. Write down everything you eat and drink, and note any flushing or diarrhea episodes with times. Begin avoiding the obvious culprits: aged cheeses, cured meats, alcohol, and fermented foods. Eat smaller, more frequent meals rather than 3 large ones. Set phone reminders every hour during waking hours to drink 8 ounces of fluid. Keep oral rehydration solutions or coconut water available for days with increased diarrhea. Create a simple daily log recording number of bowel movements, flushing episodes, and any potential triggers. Sample questions for your next appointment include: given that I'm having X number of breakthrough symptoms per week, should we consider dose escalation of my SSA? Should I have pancreatic enzyme supplementation given I've been on SSA therapy for duration? What are my current vitamin levels, particularly B12, niacin, and fat-soluble vitamins? Contact your specialist urgently if you experience more than 4 bowel movements daily despite current treatment, more than 5 flushing episodes daily, unintentional weight loss exceeding 5% of your body weight, new onset swelling in your legs or abdomen, or increasing shortness of breath, especially when lying flat. Seek emergency care for severe, uncontrolled flushing with dizziness or loss of consciousness, severe breathing difficulty or wheezing, severe facial or lip swelling, or signs of severe dehydration, reduced urination, extreme weakness, confusion. Managing carcinoid syndrome effectively requires understanding your personal trigger foods, maintaining rigorous hydration and nutrition, knowing when your medications need adjustment, and recognizing warning signs early. Your next step: start that food and symptom diary this week. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. All links are available in the description below. Thank you for watching.